Dr. Perry Allman. How are we doing tonight?
Doing all right. How are you?
Great, great. Thanks so much for coming on, taking the time. I know you're busy, guys.
No, really my pleasure. Thanks for having me.
So let's chat, man. What are you up to today? How's the day going?
So far, so good. I'm currently doing my OB rotation,
Oh,
for med school. So seeing, helping women, seeing babies. It's a lot of fun.
that's right, kissing babies, more or less. Oh, man, speaking of OB-GYN, did you see that thing going around about that medical student at the Mayo Clinic who got...
Yep. They very much, at the beginning of our rotation, they drilled that into us to very much, don't do anything that you shouldn't be doing.
Yeah, it seems like they're shunning making social media. I got that a lot in my residency, but I think that's the wrong idea to shun making social media in general. I mean, just make the right social media.
Yeah. I think the reaction I'm very torn because I understand the reaction. I don't necessarily agree with the reaction, but I understand it.
Right.
Yeah, it was watching that video. I can understand the humor. I can understand where it was coming from, but from the patient perspective, it is, it could be very, very damaging, very hurtful, very shameful. And, I don't know if there is another response that would have been, I'm, again, I know. I feel like I'm just torn.
Yeah, yeah, no, and my thoughts. This came across someone DM'd it to me like, "Hey, I know you had an issue in residency. What are your thoughts about that?" I think the videos that this guy were making were vulgar. They were very inappropriate. Should not have been making that. However, the next step is they threw him out of school on they terminated him from school on match day. Now I don't have enough context. I don't have enough background. How many times did they speak to this gentleman or this student prior to letting them go? Were there multiple meetings? Was there a suspension involved prior? Like, he should not be making these videos. This is
Yeah.
not right. However, what are they waiting for? This guy was over 200,000 followers. Anyway, oh my god! And now there's a lot of like the rage baiting of people taking his clips and everything, and like, oh, you should have made me this, and okay, maybe, but now you're just using cult culture to like point fingers. I don't know. There's a whole cascade of things. I wanted to see what your thoughts were, man, because you're also on that rotation.
Yeah.
You know what I mean? But hey, so yeah, just for listeners, viewers, if you can give a little background now. You said you're in second year of oral surgery residency, right? Where are you at? How you got to this point? What dental school you went to?
Sure. So I'm currently at Kings County Hospital in Brooklyn, New York. And I'm 2 of 6, so currently in my M3 year at SUNY Downstate, which is right across the street from Kings County Hospital. I did my dental school. I was at Touro College of Dental Medicine, class of 22. Then had a couple stopovers until finally got into Kings.
That's right. That's right. How are you liking it so far?
Loving it. Loving every day.
Like that. That's what I wanted to hear, man. Yeah, I didn't realize that you guys did rotations at Downstate.
Yeah, so we don't have, as residents, we don't, or the oral surgery department doesn't have privileges at Downstate. However, a lot of our various rotations, either as residents or as medical students, we do a lot of stuff over there.
Yeah. Yeah. Okay. Beard's looking good, man, too. Yeah.
Thank you.
That's an oral surgery beard, if I say so myself. Excellent.
Yeah, at one point in it was my D1 year. I don't remember why, but I grew it out. It was about down to here. And yeah, I did it just for a couple of months. And the reason why I shaved it is because my daughter, who was at that point, she was about a year and a half at the time, she realized that she can get my attention instead of calling out for me. She would just grab my beard and shove my head over to the side. I said, all right, that's time. And funny enough, the only person to give me grief about shaving the beard was the former general surgeon who was running our anatomy labs.
That was the only person?
Yeah, he was so upset at me. Like, Perry, please tell me you did it because you wanted to, not because anyone's making you.
What area are you from, by the way? So New York. You said high school?
Yep. So Touro up in Westchester, but I'm from Long Island. I'm a Long Island guy.
Nice. You think you'll come practice out? So you have a family. You think you'll come practice out this way afterwards, or?
So we'll see. We're open to travel. Again, my wife and I are both from Long Island. We do like it here. Our family's here, but also we got to spend some time away from New York as part of our journey, and We loved it. We were out in Pittsburgh for 2 years. We loved it out there. We're not tied down. We're willing to travel. If that's where what makes the most sense at the time.
Yeah, I completely agree with that. Yeah, sometimes opportunities, location may dictate opportunities, especially in our field where it's entirely in person. We can't just kind of. It's hard to pack up and move, and then even for you with your family, I can't imagine that. How many kids you have?
Got 3 kids.
Wow! Congratulations!
Thank you.
All during dental school or before residency?
All of the above. So my oldest was 6 months old when I started dental school. She is 8 now. My second was born at the height of COVID in 2020. That was during my D3 year. And my youngest, who just turned 2, was born right after a little after my non-cat year.
Wow! 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 Great family going. That's my ultimate goal. I don't have any kids yet, but maybe one day they'll be running around here. So okay, sweet. We have a good bone to pick. Actually, I tried to open AI because the way we connected was we were looking at the unmatched spots, and I actually drew up some years over the last. Now I don't know. I tried to go back 15 years, so I don't know how accurate those stats were. But before we get into that, though, what else? What else you want to touch on real quick before we hit this topic? Just jump right into it. You want me to give you? Oh yeah. You had mentioned a bit about your background. You said after dental school, Touro, and then you did 2 non-cat years, right?
So actually, I did one non-cat year, and then I worked as a general dentist for a year.
Did you have to retake the CBSE at all? Actually, that's a great thought.
I didn't, just because I was going nonstop. I don't think I've had a vacation since right after my ended D4. Finished my non-cat. I'm sure we can dive a little more into that, in a bit when we talk more about the match and my experience there. But after that, I pretty much picked up and I worked for a DSO in rural Pennsylvania on the Pennsylvania-Ohio border. Did that for a year, and that was, a fantastic experience. They loved the fact that I already had the year of surgical experience. The vast majority of my patients were a lot of bread and butter, a lot of extractions, alveoplasties, full mouths.
Nice.
So they love to have that experience, and it was the right place to do it. And then while I was there, that's how I ended up getting into Kings County and came back to New York.
There we go. How'd you like working for that DSO? Like honestly, like the corporate setting of it.
So it's interesting. I think there were things that I loved. A lot of people, I think DSOs, they get a bad rap. I think for a lot, again, there are definitely things that kind of people talk about that are true. There's a lot of focus on production. There's a lot of focus on being busy and being faster, and sometimes as a provider that's not always in your control. On the flip side, though, I loved the structure. The company I worked for was very big into CE credits and training us up. I got a ton of experience. Even though I knew I had the oral surgery goal in mind, anytime they gave any sort of opportunity, whether it was in endodontics, periodontics, any specialty, I said, hey, I'm in. I want to learn. And they were very open to that and covering expenses for that. And that I thought was a huge upside.
Yeah, I'm hearing a lot about how the DSOs are just grabbing up all these general dentists, sending them to CE courses, and getting them to do these specialty level procedures. You could have gone that route. You got some experience in doing that. Why did you decide to not go that route? Do it the right way. Right way. I mean, I think it's the right way. Coming back, doing oral surgery residency to get that experience. What are your thoughts on that?
For me personally, if I, as a career goal, just wanted to do bread and butter oral surgery, teeth and titanium, I definitely could have gone that route. Again, you don't have the sedation and anesthesia experience necessarily. But if I just wanted to do under local, definitely could have gone that route. I very much like big surgery. I love the operating room. I love hospital-based care and hospital-based procedures, which is my long-term goal. So for me, it was a no-brainer just to keep fighting to get into residency.
Amazing. Okay, that's a clear-cut path. I see. That makes sense. Okay, I'm glad you said that. Actually, I have a thought for you for the future, which I'll tell you off in the DM. But sweet. So now you're back here, and one more question about working for a DSO. The restrictive covenant. right? What if you went and you were in like the Pittsburgh area, right?
Mhm.
What if you had gone to Pittsburgh oral surgery residency? Would that have conflicted with your restrictive covenant in the DSO?
So it wouldn't have for me. It was, I think, I'm sure I have my contract somewhere. It was either a 2 mile, well, probably a 5 mile radius from the main area that I was practicing. But I was actually, my main practice was 60 miles outside of Pittsburgh.
Oh,
So for me, it would have been a non-issue.
easy peasy. Did you live near the practice or did you live in Pittsburgh?
Lived in Pittsburgh.
So how many days a week were you working 60 miles away?
I was there 4 days a week regularly. But hang on, you're from New York, so we could talk miles all we want, but it was an hour commute each way.
That's it?
Exactly. It right. So people in Pittsburgh, they're like, you're driving 60 miles each. Why are you crazy? I'm like, right now I have a 12-mile commute to Brooklyn, and it could be an hour and a half each way.
Right.
Right.
Okay.
So that's why I'm like, are you kidding me? It would be an hour with traffic. I would do it like in 50 minutes with New York driving. It was all highway. It was great.
Okay. That's a relief, and
Yeah.
all right, so all this makes a lot more sense now. So you did an uncut year. You did a year with the DSO, working as a GP, right? But it sounds like getting a lot of CE credits, more experience, exposure, as well as doing a lot of those surgical procedures yourself.
Mhm.
Amazing. And now you're back in residency. Do you want to give kind of a process of students that are applying to oral surgery residency on that process, what that looks like? Any experiences you have along the way?
For sure. The best advice I ever heard, and this must have been in either my D1 or D2 year, they had a panel of specialists all talking about their residency experiences. And it happened to be, and I wish I had her name, I don't have it, but there was a internationally trained dentist. I believe she was from Montreal, but she was talking about her experience and that she said she did either 2 or 3 non-cats, went through multiple cycles until she finally matched. And her advice was, if you want it, just keep pushing. It'll happen. If you don't match once, twice, the only way you won't end up as an oral surgeon is if you stop applying. And I remember at that time going, oh, wow, that's really inspirational. That won't happen to me. But that's really inspirational to hear that from someone else. And of course, here I am. And I went through 3 cycles. Technically didn't match. I post-matched into my spot. At the end of the day, all I say is, you know what? If I decided after 2 rounds I was out, that I wouldn't be in oral surgery residency if I didn't, push for one of the. If I after the 3rd time I said forget it, oral surgery doesn't want me. I'm not going to go for the scramble. If that happened, then I wouldn't be here today as an oral surgery resident. So the main advice is that more than anything else, it's if you want it, just keep pushing. It'll happen.
Right, right, and you certainly did. No, that's outstanding, and I appreciate you mentioning that on the podcast. Not many people have, literally the balls to say like some of those hiccups, some of the speed bumps. But guess what? You succeeded. You're in a residency spot right now. You're at an outstanding program. I mean, King's is a powerhouse. Some of my favorite, faculty in dental school were Kings County graduates. Dr. Willoughby, for example, at Stony Brook, since retired now, I think, but just, an outstanding program, outstanding people I know that came from there. My boss came from Kings County, Dr. Chavkin. And then you got Yusuplov's Kings County guy. Is he there at all, actually?
I don't, you know what? I haven't worked with him. I'm not sure. His name is all over the place, definitely on some of the posters we have in our conference rooms. I know that some of my seniors and chiefs definitely worked with him at various points.
Yeah. Oh, yeah, I'm certain. What are your thoughts on this unmatched process? Something you had mentioned to me in the DM. You were mentioning how you had spoken to a lot of program directors, a lot of faculty members, being that you had applied 3 different times, and they said it sounded like when you would ask them, and I mean you're a good, straightforward, honest guy, that they'd all kind of had good things to say.
Yeah, if I had a nickel for every time I heard, like, yeah, you're looking at my application, like, yeah, you're a good candidate and you're personable. Clearly you have the work ethic, and know what, shit happens. It was the amount of times I heard that it was, and I have a lot of nickels. I would be able to start paying back my student loans. And even like if I would ask, a few faculty members and program directors, I felt comfortable enough to say, hey, like, tell it to me straight. Like, me a little more than just the one interview we had. Tell it to me straight. I need to know. Is it, what's up with me? What's going on? Like, and the answer, it was always like, I don't, no one could give me an answer. So what I've taken away from that is that sometimes just shit happens. Things can fall through the cracks. Either that or everyone's lying to me and just trying to make me feel good. Hopefully it's not that. I very much would want feedback.
Right.
But again, I heard it from a lot of different people, just like, hey, like, it does not make sense. Actually, person I know, he was in the class under me at Touro. He met my now current department chair at a residency event. It was right after, it was a little after I post-matched. And my department chair said, hey, have you heard of this guy? And at the time, the D4, he said to my department chair, he said, I have no idea why Perry never matched. You gotta steal, and from there, the rest is history. But again, like, I wish I had a better answer. Had a little more closure. Like, if I found out that I interviewed terribly, if I found out that somehow being top 10 in my class wasn't good enough, if I found out my CBSE score, even though it got me interviews, wasn't enough to get me into a program, if I was just the absolute worst non-cat to the point where my former attendings were calling other programs and saying, don't take this guy. If that was the case, I wish someone would tell me, because, hey, I need to know that to be able to improve and get better. But that doesn't seem to be the case. And sometimes these things, they just happen. You just got to keep pushing forward.
Yeah. And I got two questions from that. So top 10 or top 10% in the class, just to go through these numbers to give people a visual here.
So yes, in my year, I think we had 103 graduates. We had 103, I think, graduating in my class. We didn't get official rankings. We got percentile rankings. But so I definitely know I was in the top. I think it was quartile rankings. I know I was definitely in the top quartile. But through various, like the getting an OKU, the OKU award, as well as knowing my GPA, and we were able to see just the overall curve of GPAs in the class. We were able to figure out where I stood, which is definitely somewhere in the top 10 students.
Outstanding. No, absolutely outstanding. I have no idea. We had 44 in our class. We were unranked.
Yeah.
I have no idea where I was, but I probably would. I mean, top 10% would be what, like 5-6 people. I probably was not in the top 5-6 people. So that is outstanding. That is absolutely outstanding. And so GPA was good. Ranking was good. How about you mentioned CBSE score? You don't have to go into the scores necessarily, but
I'm very open about that. I have no problem with that. So I got a 70 on the dot on the old scoring, which is a 200 on the old scoring, which I think is a 63 EPC. I actually don't know the newest scoring model too well. Yeah,
that's a great score. That is a great score. You get plenty of interviews from that.
Yeah, like, look, obviously there's going to be programs, I know, that the top programs are going to have a much higher cutoff, which I knew going in. The surprising thing and again, I got the interviews each cycle. What I found surprising is when I was applying, right, the 70, what I heard was, for 4-year programs, you're set, not a problem. For 6-year programs, they may be a little more selective, because in 6-year programs, you have to be able to pass step 1.
Right.
And we're going back now, this is 22, so it's 4 years ago. I actually got, in all my cycles, a vast majority 6-year programs, very few 4-year programs, which which is, to me, starting to make a little bit of sense. In fact, to the point where I just saw the other day someone, I don't remember if it was on Student Doctor Network, someone asking someone in AMA, or if it was on Instagram or Student Doctor Network, someone asked, I got a 72 on the CBSC. Is that enough for a 4-year program? And I saw that question and I was like, wow, 4 years ago, it was reversed. Someone would say, I got a 72. Is that enough to get into a 6-year? So, kind of segueing a little bit into the trends of what we've seen these past few cycles.
Wow.
What I believe is happening is the 4-year programs are, for, whether it's from the volume of applications that they're getting or just how the CBSE scores are going, it seems that it's the 4-year programs that you need to have the much higher scores to be able to get those interviews.
That is absolutely incredible. And I've been telling people, generally it's the higher CBSE scores going towards the 6-year programs, and that's outdated. But then again, that's from my cycle, 2021, earlier-ish, right? But now, But look, this makes sense. This makes sense. And I want to ask you about your I want to ask you about your externships in a second. But check out this thing right over here. Hold on. Where is this? I got to share the screen. I just want to show because this is starting to make sense here, and I want us to go into. Would like to record this computer screen. Yeah, I want to wait. Come on, Google Chrome. Yes.
Oh,
Sorry.
no, take your time.
This is a week old. Google Chrome may not be able to record constant. Oh, until it's quit. Okay, so it's not going to let me do it. I'll have to open it up and reboot the whole thing later. But it's a brand new computer. This is like a week and a half old. Love it. But okay, so going back to 2023, 12 unmatched spots. 2024, 26 unmatched spots. 2025, this year 20. Wait a minute.
No, wait. This year was 17, right? Hang
There were
on.
17 this year. Here we go. I'm sorry. I had to scroll down a little bit. My bad. 17 this year, 2026. 21, 2025. 26 unmatched spots in 2024.
Right.
12 in 2023. And then 5, 1, 5.
1,
I wish I could show this.
No, you know what? It's funny you say that because I think I have the same exact information here that I prepped just for this. Hang on. Right. I definitely have through NatMatch. I got, the last 10 years of data, at least whatever. They definitely have the last 5 years. That's now if I could find it on my phone. But yeah, so while I'm pulling this up, I remember with that first year when I went unmatched, right? So that was 22, 5 unmatched spots. That, that's the norm. It was still like, oh, that's a little higher because the previous year was only 1 unmatched spot.
Right.
But, 5 spots out of, I think it was 243 spots total. Makes sense.
Yep.
For that scramble, I know the clinical dean, I know people were making phone calls for me, didn't get a single bite as far as the post-match spots for the categorical spots. But again, had offers for non-cats, and that's, very luckily got my non-cat spot at University of Pittsburgh. Had a, very intense, learned a ton, but a real wonderful year at Pittsburgh. I, wish him, it was really nothing but the best. But this second year, when that match result came out, and there were 26 unmatched spots, or 12 unmatched spots, I just remember like everyone flipping out. Like, this makes no sense. What is happening? And then, of course, you jump a year later. I actually, by the time that number, the 26 spots came out, at that point, I was, I was already talking to King, so I already knew at least that there was 1 unmatched spot. And then that list comes out. I just remember, like, almost like just laughing, like what, like not in a haha, this is funny, what is happening here? This is insanity. And then, of course, we have the 21 and 17. So the interesting things that I found about all this and over the years and really thinking about it, and I'm sure a lot of program directors want to know what's happening. I know applicants want to know what's happening, residents want to know what's happening, people in OMFS want to know what's happening. And again, this is just from my experience of all my interviewing at a whole bunch of programs around the country, meeting people from all over, doing externships, talking to residents from all over the place. I think the most important thing is don't panic. I really think that it's not as scary as it seems. And something that really jumped out to me right off the bat is I think it was in 2022, there were 243 total residency spots for OMFS throughout the country. That year, there were 5 unmatched spots.
Yep.
Jumped to this past year, 17 unmatched spots. But how many residency spots are there in the country? It's jumped up to 260. So right off the bat, there's an increase in the number of residency spots throughout the country.
Good point.
So that's point number 1. So that starts to offset it a little bit. Now, for the next point I'm going to make, I am not want to make it very clear. I am not throwing any shade at any programs. I am not speaking bad of any programs. I'm not speaking about any programs in particular. Any programs that had a few unmatched spots this past year are not ones that I've actually had experience with. So, I know as much about them as anyone that might read something on Student Doctor Network, but has no other affiliation with these programs would know. But when you look at this past year, when there were 17 unmatched spots, how many of them came from two or three of the same programs? Where there
Same
were
program,
multiple, right?
Oklahoma, 3 unmatched spot, 3 for 3 unmatched. Yeah.
Right. It was
I'll say the programs. Put it on me. Blame me.
yeah. So, and again, very reputable programs that were.
Yeah.
So when that happens, the question is, what's going on? Again, I don't know about what's going on in said programs. I don't know anything about it. But again, it could be anything from applicants weren't ranking it as their top spots, and the applicants that the program wanted were not the ones that wanted to go there. It could be something as simple as, is something as simple as that, just the numbers game. Could be that, for all we know, if they had 3 spots, maybe, what is it? The average program, they'll rank maybe, or they'll bring into interview 10 to 15 people per spot. Maybe they brought in, again, they interviewed 30 people and they only ranked 10, thinking that would be enough. But those 10 people that they ranked didn't rank them high enough and got swept up elsewhere. Could be a whole slew of different reasons, and this goes for any program. The thing is that for us to speculate, we have no idea, right? We don't have the numbers. We don't have the data. But again, the main point of this is that when you take those 3 programs that had multiple spots that went unmatched, well, then that number goes from 17, that drops down a bunch. And then you might have a couple of scattered programs that have, that have 1 spot that goes unmatched. The other pattern that we're all seeing is that it's generally 6-year programs that have these unmatched spots. This is where I'm circling back to my theory, going back to the CBSE. Back in when you were applying in 21, when I was applying originally in 22, people were asking, I have a 72, a 73, a 74 in the CBSE. Will I get 6-year interviews? If people had that, the same score in the, in that borderline, that 77 to 75, people weren't asking it about the 4-year programs.
Right.
However, I can tell you in 2022, with the 70, vast majority of the programs I interviewed at were 6-year programs, and I did not get invites to many 4-year programs. And that number decreased over the years, which again, just a theory. I don't have the numbers. But if I had to make an assumption, I would think that people with higher CBSE scores, people with these scores might be applying to 4-year programs more than the 6-year programs, meaning that the 4 years are getting more competitive, meaning that people with these higher scores may be getting matched into the 4-year programs.
Right.
And the 6-year programs, which have a CBSE cutoff, generally given by the med school, may not be able to interview as many people. They're all competing for those higher CBSE scores, meaning they just have a smaller pool of applicants to be able to pick from.
Excellent points. Yeah. You touched on everything that I've heard of, right? Like they're all ranking the same, all the programs are ranking the same top pool of applicants versus all of them, so that when they rank elsewhere, they don't get, they end up with unmatched spots.
Exactly.
That's a very high predominant theory. I think it's really important to include the switch though, where the competitiveness on the 4-year side. And we also have to consider, I mean, as of 2022, I believe that 50% of dental students graduating have more than $250,000 of loans. $250,000 after 2022 dental school graduates throughout the United States. On a whole, that's a lot. That's a lot of debt. Student debt is at a complete top. So who wants to go to another 4 or 6 years? And 2 of those years, most programs have to pay for those 2 years of med school tuition. That's another thing to think of. People are in their late 20s, starting the early 30s after dental school. People want to get on with their lives, have some kids. We're talking about that too. There's a lot going on here.
And
I
so,
think big thing. Yeah.
People always talk about, like you said, you brought up medical school tuition is a big factor. Not getting your stipend for those 2 years in med school also is a big factor. Something that I didn't think about. And again, I was aiming more towards a 6-year. Again, want to do more hospital-based, big procedures. For me, the MD makes, is something that I said, hey, that's something the investment is worth it. But if somebody, wants, their career goal is more bread and butter, teeth and titanium, in-office sedation, where the MD isn't necessarily going to give them a leg up as far, in the once they graduate from residency and start their career. Not only are you working with the 2 years of tuition, 2 years of likely not getting paid, you also lose your benefits. So as
Yeah.
an intern, I had health insurance. I got additional health insurance, dental insurance, various different. We're through New York Health and Hospitals. We get stipends for a little bit to help with childcare, with certain reimbursements for I was able to for things like stethoscopes, or if you need a new phone to be able to see use Epic on. You're able to get various things like that, and then suddenly you finish your first 12 months and it's okay, now you need to figure out health insurance in July, which is off cycle for here in New York State, the New York State of Health, the marketplace. So you're either scrambling for a marketplace health plan, or you're
Yeah.
working with the med school to try to retroactively maybe get on their healthcare plan, which generally may not start, at least for, it doesn't necessarily start July 1st. So either you have to start, paying for additional healthcare earlier than you'd want to, or I know some people that had to say, you know what, I really hope I don't get injured for the next 2 months until September rolls around and I can get on the med school health insurance. So, there are definitely a lot of those factors which people really have to consider now. And it's not something that you can just say, it'll be fine. You
Right.
really need to consider it.
There's so much to consider. There's a lot of issues here. Oh my God. And then the resident, now, granted, a lot of dental specialties, when you go into residency, you have to pay for it, right? Other ones, pros, perio, endo, I think endo. GPR, no, generally, just for listeners, GPR you don't have to pay for, but, you're most likely taking call. Pediatrics, many are taking call, many get paid. But between oral surgery, pediatrics, and GPR, I would say most of the residencies are coupled with hospitals and get paid, but also have to take call. And the other residencies are generally not paid, so you have to pay tuition to get that training. And so, but so now this is in favor of oral surgery, I would say. However, people are recognizing that what you're getting paid as a resident is insignificant. It is. I mean, I remember when I was my first year in Manhattan, that was 2021 to 2022. My first year salary was $69,000. After tax was roughly 45. My rent was 34 on that first year. So that was $11,000 for the entirety of the year for groceries, for travel, and yeah. So I'll tell you right now, the first 2 years I was negative.
Yeah,
That's what happens. Like, so it's like I know people that had to take out more loans just to get through residency, and it's so anyway. Just throwing all that out there.
it's going to
It's
say,
crazy.
yeah. And so another thing that people don't think about, and I had to go through it 3 times, application fees, and especially now in oral surgery, maybe 5-10 years ago, you could apply to, if you were really spraying and praying and applying everywhere, you'd apply to 20 programs and
Yeah.
and get 15 invites and only go to 10. Nowadays, 40, 50. Yeah, you have to. You have to apply to. Yeah, again, that's in my experience. Unless you have 80 plus on your CBSE, the greatest letters of rec, and most people, you're applying to 40, 50 programs, interviews, during COVID. It happens to be, I think, there were always in-person interviews, or there were some hospitals even during COVID where they couldn't interview in person, but then you can go visit the hospital. So I had a few of those. So when you really take, some people say, oh, so many people were applying to so many places because Zoom interviews, they weren't thinking about it. And I'd sit there going, no, we thought about it. It wasn't about that. We would have traveled to these places even if Zoom wasn't going to be an option. But the cost of the applications, it's $100 per application, applying to 50, let's call it 40, right? We'll say on the lower end 40, so that's $4,000 right there. You get 10 interviews, and let's just say, all right, let's say 3 of them are still doing Zoom, and you have to travel to 7 places. And let's say you're in New York and you got 2 of those interviews are in New York and you don't need to spend because you get to drive from home. Great. Let's say you're only traveling for 5. You're talking about airfare, you're talking about hotels, you're talking about food, right? You're talking about just you're going to want to see the city. Obviously, you're not going to be spending a ton of money there, but
Gotta
you're going to be
eat.
going around. You're going to want, right? You're definitely going to want to eat. And again, some places, you go to the interview and they talk about all the places that you got to go and eat. So, in that case, they told you in the interview you got to do it.
You gotta go.
You got to go. No, but also when you're visiting a program, if you're going to a new city, it's your first time in the city. If you might be spending 4 to 6 years there, you want to see the city. You want to know where you may be spending the next 4 to 6 years.
Yep.
And I have no problem throwing these numbers out. I'm very open about it. But with 3 cycles and all of this, it's run me approximately $50,000 of additional debt in over 3 cycles. Now, hopefully, the vast majority of people are not having to do this for 3 cycles. But even still, well, for me also, I apologize. That also includes the moving costs because I moved for a non-cat. And then and the reason why I didn't do a second non-cat, I had offers to do a second non-cat in multiple programs and some really good programs, but I just looked at my bank account and said, I cannot afford to move my family another 500,000 miles to a new city to start over, because that would have added another, easily another five to 10 grand just in a move. So
and get a residency salary when you could be working like you did at DSO,
exactly.
Philadelphia, Pittsburgh.
Exactly.
Yeah.
And I had people, I know there were programs that saw my application and said, he didn't do a second non-cat. He doesn't want it. I know for a fact that, I know I had there was a place I was interviewed at and they're like, oh, the program director is going to ask, like, if they even give you an interview, that's going to be half your interview is grilling you on that. Like I was told straight out. And again, that's not every program.
You have 3 kids.
Yeah. You'd think that people were more,
understanding. Growing trees.
Yeah, but again, so that's where I want to make sure that $50,000 number also includes moving from New York to Pittsburgh and then back from Pittsburgh, to New York. So if I would have taken a non-cat in another city, even if it was close by, moving is crazy expensive, and that just would have tacked on another 5 to 10 grand easy.
At least
it's these are things that really it's. The things to consider, we'll say, I know we're throwing all these out there for anyone that is interested in oral surgery. Yeah. If it's something you want to do, it's worth every penny. I have no regrets. My wife might sometimes. I don't. I certainly don't. My wife is a saint. I swear. I couldn't have done it without her. And she could have pulled the plug. She absolutely could have pulled that plug on my career. But no, she was with me every step of the way. But no, it's a lot. We're talking about it from the applicant side. If you flip the tables, I don't envy program directors. They have an insanely hard job as well.
They do.
So when you think about, now we have all these applicants, right, who have these crazy high CBSE scores. I've heard programs getting anywhere from 120 to 160 applications for 1 or 2, 3 spots.
Even more. I've heard even more. Yep.
Yeah. Those are it's. And I'm thinking like, okay, as an applicant, even if I applied to every single oral surgery program, right? So it's 102 or 100, right? Between all the programs, and some of those are, have both 4 and 6 year. If I did all that, I can make a short list, right? That's doable as a dental student, right? Where I can have the time where I can do that. A program director who's also managing residents, managing cases, running a program, and now you have to go and sit and go through 160, 180, 200 applicants.
Right.
I just remembered another number. It was one program I externed at. It was in 2022. They told me 211 applicants for 2 spots. Ooh. And that was a 4-year. That was a 4-year program. Ooh. And that was eye-opening for me. And I'm thinking, how do you narrow that down? Because I'm sure, let's just say, out of that extreme, 211 applicants, let's say 50 of them bombed the CBSE. They were applying just for shits and giggles, and the letters of rec say, do not take this person. Let's say it's the worst applicant on paper. Let's say some crazy, right, you eliminate 25%, or the absolute, or anyone would say, we're not inviting for an interview. Right. How do you narrow it down from 160? How do you narrow it down from 120? It's I can't imagine the amount of work that programs have to do to find applicants or find the applicants that they want to bring in.
I will tell you real quickly what I would do if I was a program director. I would open externships up at least 2 a week for most of the year. I would try and do that most of the year. And you know what? I would spend a lot of time with those externs, a lot more than when I was an extern, that I was getting some attention. And it's not about attention, but you want to invest a little time to learn about the people that you want to give interviews to. So yeah, no, but look, I mean, you're going to be there anyway. You're inviting them to come visit your program. Your residents are going to be monitoring them, taking care of them, everything. But it's a little opportunity, and then you ask every resident's opinion of, oh, what'd you think of this, or what'd you think? You have your weekly or monthly meetings and go through the list with them. Definitely with that, CBSC is a good thing, and then kind of looking at the externships. How committed are these people doing? Non-cats, how that actually gives me a question. How many people in your year at Touro applied to oral surgery? Just two quick questions for
Oh,
you from
sure.
there.
So in my year, we had, so in that first year, I believe 4 of us applied. 1 matched as a D4. 2 of us did non-cats. 1, I believe, did a GPR, and I believe one decided to go a different direction as a super GP. But another one of my classmates didn't apply to OS that first year, but did a GPR with the path of going into oral surgery. And in my class, we're all 4 for 4 in residency.
Now, yeah, excellent. Okay. So it was 4 in your year. 1 of 4 initially got in that first year.
Mhm.
Okay, and then which is fair. How many externships did you do when you were applying out of dental school? Because I just had 2 questions from that first visual, that picture, trying to give people what it's like to apply to oral surgery right out of dental school and what that's going to look like. And then also, if you remember how many interviews you had
Oh,
applying,
sure.
those are the last 2. Sorry about that.
Yeah, no problem. So I did, and this was very rare because this was 2020, 2021 when I was doing these externships. I actually had 6. And
Wow.
yeah, I got very lucky. It was 6 externships at 5 programs. One I doubled up.
Yeah.
Touro has had some relationships. I believe they still have these relationships with a couple of local hospitals in New York. So, and as part of our curriculum, we would do hospital rotations. So we were able to, and you'd rank where you wanted to go. So if some were just in community health clinics, and 3 of them were in hospitals with oral surgery programs. So anyone that wanted to do oral surgery, you pushed and were able to try to find your way to spend a week at these hospitals, which was great.
Right.
And
that's a stellar application. By the way, for listeners, that's the COVID year. I can't tell you how many externships people throughout the country, including myself, had scheduled, and they got canceled because it's you're in the middle of COVID, 2020 to 2021. So that is a stellar application right there. Okay. Let's
definitely.
continue.
And on that note, definitely the some of the biggest learning experiences. One as a student, right? Because as a D4, right? What do I know of oral surgery? Now, Touro when I was there didn't really have any direct relation. We had, obviously oral surgery department, and remind me, I do want to talk about oral surgery in Perio. I know that's been a discussion recently,
we'll get there,
but we'll get there. So now. Touro College of Dental Medicine with New York Medical College and Westchester Medical Center. So we have some of the Westchester Medical Center residents. I do believe at this point, we're starting to build a relationship with having residents come into the dental school. I do believe now it is a regular thing. But when I was doing the vast majority of my first years in dental school, we didn't have oral surgery residents in the school, meaning that who's doing all the procedures? The students, which is great. So, that was a big positive. You get a lot of that hands-on experience, but then you don't have the relationship, that personal relationship with the program.
Yeah.
That's the other side of things where it's, hey, if you go to a dental school that has the residency programs in the school, it's much easier to make a bad impression. But generally, if you really want it and you're putting in the work, you're building that relationship, and it goes very far. But again, you may not know what it's like to be in an OR. If you're just a D4 in dental school,
right?
You may not know what it's like to be on trauma call. You may know in theory what it's like to work 80 hours a week, but until you do it, you don't know what it's like.
No idea.
And even as an extern, when you're doing 80 hours a week, it's not the same when you're an intern doing 80 hours a week.
Or 120 hours.
No. Hang on. The law says, we know what the law says. No one ever works more than 80 hours a week. Ever. Oh, man. But my advice generally is, yes, those externships are going to be huge. The best advice I got when it came to externships was push yourself out of your comfort zone, in that don't just stay local.
Right.
If you're from the North, go see a Southern program. If you're from the South, go see a Northern program. Go see them Yankees, right? See how they do things up in the North. I spent a week in a Southern program, and it was amazing. I like to say surgery is surgery, um, but sometimes how things are done,
Yeah.
patient populations, the characters you're going to meet along the way, it was a blast. It was amazing. So really, make a push for it. I know some schools are better and able to give more time for externships than others, but if you have the opportunity to do it, do it. It's worth
Oh
it.
yeah. Hospital bureaucracy, the politics that goes on between surgical
Mm-hmm.
services in the Northeast, and then versus like the amount of scope you could actually push through in the South. Yeah, it's. I highly suggest everyone doing that. How many? What was the last one? How many? Do you remember how many interviews you got that first
Mm,
application cycle out of? I think that's my last question for. I
for
just want
sure.
to round out the entire topic. You know.
For sure. So that first cycle, I believe I got 9 interviews. Yeah, which again, that's the thing where it's, what is it? If you get 7 or more, what was the statistic? Like it's a 90% chance of matching,
I
or
think
it's
yeah.
like
Yeah.
something like that. Or I'm sitting there with 9 interviews going like, all right, I got this. Like, you know, I'm not going to be in that 10%, and that's what happens. But again, the surprising thing is that was 9 interviews. I
Mm,
believe
mm.
7 out of 9 were 6-year programs. And I was shocked. I was like, wow, I'm getting these 6 years. And I knew, you know, it's one of those where I applied mostly to, I think it was, if it was out of New York, I applied to 6 years. If it was in New York, in New York, I applied to every program, which is a lot of 4-year, a lot of 6-year options. If it was a program that had a 4 and a 6, I believe I picked the 6 across the board.
Mm.
And to me, it was like, all right, I'll probably get a bunch of these 4-year interviews just from my stats and what I'm seeing on Student Doctor Network. But in the end, it ended up being that I got a lot more of the 6-year interviews. And that's, going really bring it back for full circle. I do think now the question is, if someone really wants a 4-year, that 70 on a CBSE, which used to be, when I was applying that, everyone said, oh yeah, you'll get all the interviews. And if you spoke to at the time in 2022, if you spoke to some more old school surgeons, they'd say, if you get a 60 or above, you're fine. They're still figuring out this exam.
Right.
And, when you really think about it, the CBSE is only about 10 years old, 11 years old,
Something
right?
like
So,
that.
right. And in that time, the scoring has changed multiple times. So it's a lot of changes, a lot going on. But I would say if you want a 4-year program, you're going to want to ace that exam. You're going to want to ace that CBSE because
Yep.
what, again, it's I'm a little bit of an enigma with my application. I haven't met anyone else that has had a similar application to a similar timeline of amount of times they've had to apply. But
Mhm.
that being said, it's I know for sure. Let's just say I got a 70 on the CBSE. Let's say that was a 74, 75.
Yeah.
There some programs are cut off definitely could be that high. If I
Right.
had a 75, 76, 77, I certain I would have had double the amount of interview invites easily.
You think so? Yeah.
And again, the more interviews you have, higher chances you have of getting called in. So, really, really, really push for that CBSE. And, one thing I wanted to mention, actually, just started to, we were talking about the ways for programs, you're talking about the externships and bringing people
Yeah.
in to see the program. One amazing thing that only one program did that I applied to, they sent out an email, and in case they're not doing it anymore, I don't want to call them out. But it was one of the greatest things I think that they did. And they first year, I believe that they were running this pilot program. I think in the end they ended up not being able to do it because the program director came down with COVID. They told this was all public. They told us in an email, so
Yeah.
they had to cancel. But then the next year I applied, they emailed everyone saying, if you meet our criteria, just the basic cutoff, we're going to schedule a 2-minute face-to-face Zoom interview, rapid fire, kind of speed dating to see, do you like us? Do we, is there a vibe here?
Mm.
And after that, they said, we'll take, a couple days, we'll review it, and then we'll start sending interview invites out. And it's amazing how far 2 minutes face-to-face with the program director will go,
Yeah.
right? When you're sitting there and they're saying, oh, hey, so you're you're applying from here, just quick banter. Do you know so and so? Do you know that? Because again, they're not interviewing you at that point. It's more just let's meet
Quick.
and right, quick chat. And if you're just there and you're personable, and as and one person described the opposite of personable in an interview, if you're not a potato and just kind of sitting there as a lump, right? That is a huge leg up. That
Yeah.
and that's a huge huge leg up and a great way for programs to quickly meet someone off of paper, right? Because
Right.
again, I was joking before saying about 50 of the 200, a program that gets 211 applications and 50 of them were the absolute worst, where the letters of rec say do not take this person. Let's be honest here. If 211 people are applying to a 4-year program, I'd say a vast majority, at least 180, you're looking at these applications going, how do I cut these down? Everyone
Filter
is
them
top
out.
of their class. Everyone has a CBSE. Everyone has a letter, has letters of rec.
Yeah.
Especially now with Chat GPT, I'm sure the personal statements are written better than ever.
It's
No,
true.
right? It is what it is. So for program directors to, the fact that this one program, they figured out I thought was a fantastic way to start, cutting down, like, hey, how can we find a way to cut down on these applications? Let's just we know what our baseline is. We don't
Yeah.
have to assume and say, well, is this person the type of person we're looking for? I don't know, based on what I'm seeing on a resume, you can't really tell. Meet the person for 2 minutes and and they were able to knock it down. Let's say, they had 120 applicants, and if 65 met their criteria, and you can knock it down to 35 for an interview, or invite 40 for an interview, and not everyone picks it up. And it's a quick, easy way. It takes
It's a
half a
great
day to
idea.
do, and I thought that was a phenomenal tactic.
I think it's a great idea, and I think we just brainstormed a few ways that programs can really utilize to filter in. But we're almost at an hour. We got a few more topics to cut through.
For sure.
Now, the third try you're in. How, honestly, thinking about it, what about other people who once, twice trying to apply to get in? Would you have applied a fourth time?
It's hard to say. That day, the third time around, was, out of all of them, probably the most rapid fire of progression of events. The first time I didn't match, it was really rough. That was, especially being all hyped up.
Yeah.
Statistically, it didn't make sense, and then you're waiting until 12 o'clock to see the list, and then there's only 5 spots, and none of them were at programs that that I knew anyone that might have been able to reach out, who had a personal connection with the program director, right? So it was, it was more of a scramble to get a non-cat, and back for a few years, non-cats were insanely competitive.
Yeah.
So I was very lucky. I had multiple non-cat offers, and I was very lucky that I even got one. But I was able to choose Pittsburgh, and again, it was great, definitely a great choice. But it was a bit of a slower, slower progression. The next year also, had a little more of, a couple more bites. Again, there were a lot more. That was the 12th year where there was 12 open spots. Interviewed at one or two places for a non-cat. I think I got an interview at one of the programs for a post-match spot. Again, it was one of that place offered me a non-cat. They weren't able to offer me the categorical. But then the next year, but at that point, that's took a few days, and said, all right, I that's when I made the call to stay as a GP, because I couldn't pick up and move to do that other non-cat. There was a lot of discussion with my wife and all that. So going in round 3, saying, hey, if I don't match, that's when it was very much as I really want to do this, and this is my career goal. This is when we got to say, hey, like, we're really in the hole here for a lot of money, a lot of time, and it's year after year after year, it's going through these cycles of, well, where are we going to be next? What's going on? Where are we going to be? So and it's a little after it's 8 o'clock, 8:30. Get the email, says I don't match. So I'm sitting there going, like, I think I had about my gut reaction was, all right then. Like, it was just a moment of, I don't know, I not giving up. It was just a moment of feeling like, all right, we're gonna have to think about this. Like,
Yeah.
my wife was ready to say at that point, like, hey, we need it wasn't a matter of giving up on oral surgery altogether. It was saying, like, okay, are we going to have to work for a GP, work as a GP for a few years, build up my skills through CEs, and try again in a little bit once we've, figured things out a little bit more. And, and I got, so there was a lot more just very pragmatic, like, hey, at this point, it's not a matter of, giving up a fight for doing a 4th cycle in a row. It's, can we afford this? Is this,
Yeah.
we put our kids through this? Are we going to be like, how are we going to be going about this? And as I'm having these discussions, I get a text from my one of my classmates, now one of my co-residents, saying, if you didn't match, call me right now. We have an open spot. I will bust down my program director's door. to get you here. We're making this happen.
Wow.
And the rest is history. So, luckily, when it came to the scramble, it wasn't much of a scramble. By, let's call it at 12:01, I already had the interview lined up for Kings County. And by the end of the day, it was, and it was, again, we interviewed, and I visited Kings County before in previous cycles. So it was, people I met before, and I knew, I had my classmate from Touro as one of the residents. And everything just meshed. It all came together. So, it's hard to say, for me, what would have happened next, because
Right.
if 12 o'clock came around and I didn't already have, the interview lined up for Kings County for that post-match spot, and I saw 26 unmatched spots, that's a little more of like okay, there's a lot of, that's, 25% of, not, well, about, 10% of the spots, give or take, are open. This might be worth a fight. Let's let's push. Let's see what we can do. But luckily, I didn't have to. Well, didn't have to, because at that point I already had had the gears in motion. It's funny because over the next day or two, I had a few programs reach out to me about also non-cats and interviewing for the spots, and I was able to say, "Oh no, I'm accounted for.
I'm locked up.
Yeah,
I'm locked
up." So yeah, it's a very I like to say it was a crazy way to get into the field of oral surgery, or really to finally, because again, once you're in, then it's on you, right? Just got to keep working and, keep working and learning. And luckily, I'm loving every minute of it.
That's right.
Yeah. Like, again, I, 2 intern years, but, I kept saying during my intern year at King's, people would ask me how it's going. I'm like, look, it's, it's insane. It's intern year 2.0, but I'm having the time of my life. I really just had an absolute blast. If you want to do oral surgery, it's a ton of work, but it's worth it. It's great.
Oh yeah. And the direction you're going and where you're at, and you're going to get the 6 year, you're going to get the MD. I think that all makes sense to the pathway. So this is a really bright trajectory. Now, for others that are listening, because thinking about it, I had 2 things. I got another 2 questions that I really want your insight on. I was actually talking on So first question would be, I think you mentioned some really good points there. You would have had a long discussion, a deep discussion with your wife, family discussion. Would you reapply? Would you work for a year? Is this it? Are we packing it in? Are we going to go all in again for another year for a 4th time? Came down to the family discussion, finances, probably location. That I think these are some really important things for people to think about if they don't match into a year or again into a year and so on consecutively. I think these are really important points to consider, because the finances, tacking on loans, that's a really good point. So I just want to thank you for that. But then now I just had a phone call this evening, a student who's a D4, he committed to a non-cat position, however, took the CBSE once and didn't get the score they wanted, right? And they said they already committed to a non-cat. Now, generally, my thing is, if you don't have the CBSE down and you have everything else, just let's say that they have everything else on their resume and on their application, all of it, the externships, the ranking, it's just the CBSE they don't have yet, right? Or not a strong enough score. Do you legitimately think you have enough time to study for a CBSE during a non-cat?
It's tough.
Right?
It's really tough, because it's not about the time to study. It's the time factor, and it's also the adjustment, right? The hardest transition I think most oral surgeons go through is that, if you're going straight from D4 into an intern year, insanity that is that first month or two between, you're going from like trying to, confirming, in dental school, confirming with a faculty member the right dose for, amoxicillin on a patient with, that got a root canal. And you're going to, stitching up a 7-centimeter lac across someone's face while the pager's going buzzing off the hook, because you got
the 7th time in a row,
right? And you got your chief breathing down your back, and you got that adjustment is brutal. So It's not even the time commitment; it's the amount you have to learn that's oral surgery focused in such a short period of time, getting the least amount of sleep you've probably ever gotten in your life. And I'm saying that as someone who has 3 kids. The least amount of sleep you're going to get in your life is going to be those first couple months, during trauma season in oral surgery as an intern. That's where it gets brutal, because let's just say, you've studied for the CBSE and July 1 comes around and you've taken practice exams and you're acing those practice exams. 3 weeks later, when you're taking it, at the end of July, at that point, you're, obviously not working over those 80 hours a week, because as we
Oh,
discussed,
no.
never doing more than 80 hours, right?
No.
Definitely going home for post call. So no, but 3-4 weeks later, when you go to take the exam, and let's just say you don't lose any of that knowledge, you're going to be going into that exam so beyond exhausted, that it's going to be tough to do well.
Yep.
Have people done it? Absolutely. Do I think that it's worth, the flip side is, well, let's just say, you want to boost your CBSE, but you really want to do oral surgery. You really, think you can thrive in, that environment, and you really don't have an interest in doing more crown preps. The flip side is it worth it to do a GPR just for those first few weeks, right? For the CBSE. Now, if you're talking about a CBSE grade, like they got a 45.
If you get that score, though, here's the thing. If you're taking it your second, maybe third time, what if you don't get the score, too? Because those 2 weeks, you're definitely not putting yourself in an advantage when you take that exam. Like, you're exhausted. You might be seeing double because you were staying within those 80 hours a week. Yeah, of course. But then what if you have to take it again, and now you're in the thick of intern year as a non-cat, trying to study for that thing? Yeah, so
it's really so tough, because I've been asked that advice too, and I can never give an answer. It's really got to be a case by case,
Yeah, that's the biggest thing. Case by case, for sure. I generally go with okay, you have everything else, but you need your CBSE. I think you need to make sure you have time to study for that CBSE. You only have 1 year, which means you have 2 tries. What if you don't get on the first try? How are you going to make up for that in the middle of a non-cat year when you've gotten the least sleep ever in your life?
Right.
That's the point that I make. And I think they were receptive to it, but they were like, oh, I'm going to do it. I usually get – the problem is that I was talking to someone who already committed to a non-cat position before, really kind of thinking it through, which happens sometimes. Everyone just gets pushed. Oh, you didn't get in. You got to go non-cat. I think you have to consider, you need to sit back to have the self-awareness to say, okay, why didn't I get in? And it may not be so obvious, as we know.
Right.
But if there is one thing you could put your finger on, you got to go all in on that thing, generally. Just my thoughts. So,
yeah.
But,
I would say there's a whole lot of depends, right? So if this person, they took the CBSE, didn't get the grade they wanted, but they also didn't apply to oral surgery, they only applied to GPRs and then reached out for non-cats, then I would say, hey, do the GPR. But because you don't know, again, depending on the score and all that, but then I might lean more towards doing the GPR. But if someone got a CBSE score, let's say a 70, whichever, or what's it, 200, which is whatever EPC is now.
Yeah.
And they got a couple of interviews, so they know they have the CBSE to be able to get some interviews, right? Then it could be a little more of, hey, you're getting those interviews. Then you could start saying, well, all right, where's the non-cat? When you spoke to the program director about taking the spot, is it something where, is it a program where they historically take their non-cats? Is that a place where, if that's the case, would you want to go there? Is it a place where they historically don't take their non-cats, but the program director is, has a lot of connections at other places and will make a big push for you? Is it a place that historically has not had good luck matching their non-cats? There's a whole lot of factors. There's some programs where, they love having non-cats, but they bring them in for the labor, and it's not so much about having a match somewhere. Again, that's where it goes into the case-by-case basis, program-by-program basis, and really doing the due diligence. And then also just on the GPR side, there's some GPRs that, you're taking trauma call. There are some GPRs where you're working side by side with the oral surgeons, and you'll have, a lot of great opportunity to do oral surgery and to create a relationship with the oral surgery team. So, that's another big factor as well. If you have an opportunity to do a oral surgery heavy GPR and also prep for the CBSE, that, the best case scenario, that could be a fantastic scenario for an applicant in that situation.
Right. That would be a win-win. I completely agree. So, no, these are excellent points. Whoever's listening to this is an outstanding point for later on in dental school, D3s, D4s, thinking about it, maybe haven't taken the CBSE yet or took it and don't know what to do next. This this chat, I mean, we're hitting every single base. Do you want to get into the perio list
Oh yes. So,
to
you know,
finish it up?
for
Yeah.
sure. So, what I what I loved about my time at Touro Dental is I was the third graduating class. They really put forth their mission was that this they really wanted to create a modern dental school, keep everything up to the times. Everything was evidence based. They really touted evidence based dentistry, evidence based medicine, and huge collaboration within all the specialties.
Yeah.
So we didn't have a perio clinic and an oral surgery clinic. We had the surgery clinic, which had both perio and oral surgery working together. So everyone was doing everything, which was huge. Now, granted, once in a while did a periodontist slip? Oh, the butcher over there. Yeah. And jokingly, if an oral surgeon broke a buccal plate, did they go, should have been a perio? Yeah, they throw those things out there. But it was more, I found, at least, in Touro and the relationships that we all had in the clinic, again, between perio and oral surgery, the relationships, that was more said tongue in cheek than the butchers, the oral surgeons, right? Or, oh, the periodontists with their buccal plate that must be saved. Like, it wasn't, like, it was more like tongue in cheek, elbowing each other, and being like, all right, hey. So it was very collaborative. And I, really hope that that is the future overall in dentistry. I think that, at the end of the day, we're all dental trained. At the end of the day, we all have the same goal, which is we want to help patients, and we have, hey, a lot of overlapping skill set, right? The same way in oral surgery, you'll hear some old school, well, even, you'll hear, it depends on the program where training was done, but you'll hear oral surgery versus ENT going at it, right? At the end of the day, there's a lot of crossover, and there's things that are, we'll agree on, things that we do differently. But at the end of the day, if we just, work together on cases and you realize how much we do is really very much the same, and that we all have the same goal, which is we want the best for our patients. And I think that if we all keep that in mind, it makes practicing a lot more fun, a lot better for everyone, and just a lot more collaborative.
I 100% agree. I really think that we need to get oral surgeons back into dental school more. And I think the
Yes.
clinics should be, whether they're combined or next to, I think perio and oral surgery should both be learning and collaborating on cases together. I really think they do. I really don't like the way NYU's doing it. I'm going to call it the university itself. I think NYU's doing a very poor job at getting oral surgeons into the clinic there, teaching and mentoring students, giving their students some exposure to surgical procedures. And it's also on the hospital systems, pulling all the residents away from the dental schools. So dental students have no idea. I could count on more than two hands how many dental students over my 4 years at NYU were graduating and didn't know that oral surgeons placed implants. That being said, I can't tell you how many times perio was stealing the few implants that oral surgery was getting in the clinic within the dental school. But yeah, so the school needs to do a much better job getting oral surgeons back into the dental school and working together with perio. There's so much that oral surgery needs to learn from the periodontists. There's so much that the periodontists need to learn from the oral surgeons. I mean, we could go into the whole discussion of I mean, this is a can of worms for another time, but ideally insurance companies really need to completely revamp and need to go all in on preventative care. General dentists shouldn't be just hop, skipping, and junking to pull out every single tooth and replacing it with an implant. So they should have adequate and appropriate reimbursement for preventative care. And maybe just oral surgery and perio should be doing most of these implant cases and learning from each other. And now not only doing the implants, but also maintaining them and working with the restorative dentists to learn from their expertise. How did I, you want me to do this better? You want me to tilt it a little forward, a little more mesial, a little more distal? What do we got to do to work together for patient care? That's the name of the game here. And I think we're really dropping the ball because everyone's just pointing fingers on each other. The system is designing it to be that way. And that's not right. That's not correct. It's a collaborative space. It's a team effort. I could talk your off about this all day, but you know, we're gonna have to have a part two. We're gonna have to part two, which is a good thing.
When, yeah. I'm in the med school era, so I've got plenty of time for the next year and a half. You let me know when.
Year and a half.
It
Okay,
was
we got some good time. Yeah,
actually at this point, let's call it a year. But
a
yeah,
year. Okay.
I'm wrapping up M3 in the next few weeks, and then I'll be doing the M4 year, and then once I hit Gen Surge, you may not see me for a bit.
Okay. So then, before then, after then, like whenever, let's definitely get a part two in. Let's see what how receptive people are to the topics we talked about, I'd really like to throw it out there and see what we can elaborate on, what more answer, what questions we can answer. Hey, this was a great episode, man. We touched on so many golden topics here.
Oh, it's really
And
my
thanks for coming
pleasure.
on.
Oh yeah, no, for sure. Thanks for having me. And yeah,
Yeah, man. We'll talk again soon. And thanks for taking time out of the day. I know these rotations sometimes they're not very forgiving and saying, "Oh yeah, go. You got a call? Go ahead." They're like, "Shut up and get back to work."
I will say sometimes it depends on the rotation. Usually it's the surgical field. So OB-GYN works for. If you find the right resident, you're like, okay, I know I'm a med student, but I'm already right. Like I had one, one quick last thing. One of the OB residents I was working with on nights, she was like, "Hey, we're gonna go see a consult. Usually I let the med students kind of see the patient, but okay, don't be insulted. I'm just gonna do it because I want to do it real quick." And I said, "I'm gonna stop you right there. You go right ahead." Like I will. Like I was like, "You want me to do scout work? I got you. I've got that experience. Like you rock it out." And then once they heard my what was up, they're like, "Oh, this is great." So then they like you just go into that surgical shorthand, and
Yeah.
they love it and it's great. And then also if you got to go a little early, I mean not tonight. Now it's already 9, 10 o'clock at night. It was a non-issue, but you know dropping that every so often, generally with the surgical fields, doesn't always work with the medical fields, but the medicine side of things, but definitely the surgical rotations, they get it. It's great.
Yeah, man. Yeah. No, I'm glad you were able to take time. Hopefully, no one's getting any trouble or anything. But
No,
all right, man. I'll let you go. Yeah, let's keep in touch in the DM. This was a great chat, man. Thanks for coming on again.
right. No, really, thanks for having me again. I'll say, this is great speaking to you face to face for the first time, but I've been following you since definitely since 21, at least 21, when you started posting all your stuff.
Oh,
Uh,
thank you.
yeah, and really, appreciate it. Keep up the good work. I love what you're doing. Education is key. So, I know you
Yes.
don't mean to glaze you over too much, but really, thanks for what you do and keep doing it.
Thank you. Thank you. Education, mentorship, and just talking like this. Let's talk about the problems. Let's talk about solutions, and hopefully one day things will change for the better.
Sounds like a plan.
And hey, anything I could be accessible for you. If you would just want to chat sometime, hit me up in the DM. I know residency has its ups and downs, and I mean, I think there's a lot more I can learn from you as a father of three and such. But still, we're in this together. You know what I mean?
Sounds good. Yeah. Hey, you ever need, I can definitely, when it comes to family and family advice, and when it comes to, that could be a whole nother, that could be a whole part 3. Believe me, when it comes to, family dynamics and residency. But if you ever need anything, please, hit me up. Anything you need, let me know.
Thanks, man. Thanks, man. We'll talk. We'll talk. All
Sounds
right.
good.
Have a good night.
You too.